Welcome back to Houston Life. We often talk about the importance of staying on top of your regular health screenings and doctor's appointments. Well, the same goes for your dental health. Ignoring symptoms like bleeding gums or pain while eating can lead to bigger issues. Dr. Michel Azer from Texas Dental Implant Center is here to chat about periodontal disease, what to look for, and how you are helping patients essentially restore their smile so they look better, they're healthier. Welcome to the show. It's good to see you.
Hey, Derek. Thanks for having me.
This is a shocking statistic. A study conducted by the American Board of Periodontology found that 49% of the population in the U.S. has periodontal disease.
Yeah.
What exactly is periodontal disease?
So periodontal disease is loss of bone and gum around the teeth. So every structure that's holding a tooth in place gets lost. And over time, if it's too aggressive, then teeth can get lost, teeth can move, and then how our patients would feel it is when they're biting on harder food, they're feeling pain. It's not the typical cavity pain, but it's like a nagging, dull pain.
Okay, it doesn't seem like a great situation. What are some of the other symptoms of periodontal disease?
So bad odor, bad breath, pain when you're chewing, bleeding gums, these are all symptoms. And it goes silent for a long time before we can start to pick up, because by the time it's painful, it's already in the aggressive state.
And this is something, the symptoms we're seeing on the screen right now, daily life is complicated by these symptoms. I mean,
Right.
we use our mouths for everything. Obviously, chewing, eating, that's critical for speaking, for smiling, when we're meeting new people. So this is something that you see patients dealing with for years, if not decades, before they come to see you. Is that true?
Yeah, I think it has a big social impact. Imagine you just consider yourself that you had periodontal disease. Every time you're going to meet someone, you're worried about breath, you're worried, am I going to be able to speak properly, chew properly in a social meeting? And a lot of people are affected even in their income because they cannot be attending meetings, doing their sales, conducting interviews. So this is so important.
An important thing to consider for sure, if people don't feel like they can go out in public and really face the world because of a smile that is not functioning properly. Another issue is infection. And I think what a lot of us don't consider is that implants can actually help prevent infection. It can not only make the mouth look better and address those cosmetic issues, but it can improve someone's health.
Right. I can tell you a lot of patients decide to leave their teeth even though they have infections because they feel like once I lose my teeth, there's nothing to replace it. And they would accept having a non-ideal smile or teeth in their mouth because there's no replacement. But implants, like you mentioned, if we eliminate the disease and replace the teeth with implants, then we're taking back the body back to health, or the oral cavity back to health. And that way, if you keep the implants healthy, then it will minimize the bleeding, minimize the infection that can happen afterwards. And there has been a huge study that conducted that oral cavity infections can affect the heart, it can affect diabetic control, all of these aspects.
These really are very important things to consider. We're seeing an animation on the screen right now of how this ONEARCH procedure works. So those implants are installed several places, we're seeing, in the bone. And then after this heals and the temporaries are removed, your patients are left with a finished product that is beautiful, custom-made, perfect for their face and body.
Exactly, yep.
How long does the process take? Like if someone's going to call you today and they want a consultation, how long until they can have that smile?
So normally it's about a week to 2 weeks maximum. It's only from the time we see someone for a consult, we talk to them about what the design of the teeth are going to look like. First of all, we have to see if they're a good candidate, and most of our patients were told before that they were not a good candidate because they don't have bone, but there's many ways to help them out. And then it's just a week till you get the design.
Wow. And I mean, the before and after photos, you've always shown us the finished product on your patients. These results really are incredible. Let's hear from one of your patients, Donald Toney.
My name is Donald Toney. My journey began when I began to have loosened teeth. My little granddaughter said, "Papa, your front teeth are moving when you talk." And I'm like, oh my God. Even she's noticing, total health can actually go down with having bad teeth. It was literally eating Orajel with toothaches. Dr. Azer actually sat down and he showed me the pictures and what he could actually do. You know how they actually pass you the mirror and everybody's like waiting? You know, most people bust out crying. I bust out laughing. I'm like, whoa! You know, it was like, am I supposed to be crying that I'm so happy? No, I'm supposed to laugh when I'm happy. And I've been laughing ever since. My grandson even told me, he said, Papa, you look good. And I gave him $5 for that. Now I'm in the clouds. And I'm happy. I'm happy with the process that I had done. Dr. Azer is one of the best in the business. He took care of me, and I'm sure he can take care of you. You could even look like this.
Okay, you can tell Donald likes his new smile. He's a fan of yours. Final thoughts for someone out there who they can identify with the bleeding gums, the pain, the bad breath. What do you say to that?
I think the early intervention is so important. If you feel like you've had periodontal disease or any of these symptoms we spoke about, get yourself checked. We can do that as well in the clinic. And then we can give you options if the teeth can be restored or we can replace them with the implants.
Your smile will look better, your mouth will be healthier. Dr. Michel Azer, thanks so much for stopping by.
Thanks for having me.
Good to see you. And in the meantime, a reminder, the Texas Dental Implant Center does have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. The consultation will include a one-on-one consultation with Dr. Azer and a 3D scan and x-rays. It is all valued at $1,000. To schedule your appointment, you can call 346-ONEARCH. That's 346-663-2724. You can also visit them online at bestdentalimplantshouston.com. And don't go away. Houston Life will be right back.